once again.
Thank you, Hindi team.
Over to you, Doctor.
Thank you, Dr. Deepamalaji. And now we are moving to English session. We'll start the session with a silent prayer. Good evening and welcome once again. Today is our 1465th day of continuous webinar. Thank you everyone for joining with us. Thank you all the faculties. You are sharing your knowledge here. Each of us benefit, win-win. We are benefiting from, we are sharing the knowledge each other. Today's our guest is Dr. Srinivasan. He is a visiting professor of Homeopathic Medical College, Salem, Shivaraj Homeopathic Medical College, Salem. He took MD from Sonaji Rao Homeopathic Medical College, Maharashtra. And he is a well-known speaker in India, nationally and internationally, in India and Canada, and practicing at Chennai and Salem. And he has 22 years of experience. I'm welcoming Dr. Srinivasan to our forum. Thank you, Dr. Srinivasan. I'll make you as Dr. Srinivasan is here. Dr. Srinivasan, I couldn't find you out. Can you please raise your hands? Dr. Srinivasan, has he joined? I think doctor has not yet joined. Okay. Okay, doctor, I have seen you. Yeah, now you are the co-host, and I have to share, right? I'll share. It's visible, I think. Dr. Srinivasan.
We'll share one other screen, Doctor. First, we'll go to PPT.
Yeah, now it is nurse obstetrics, right? Now it is, yeah. So please, sir, you can start.
Sure. I'll show another screen first.
Okay. So will you share the screen?
Yeah, I will do.
So I will stop, right? Okay.
So NER repertory is one tool we are going to see today to solve certain cases. It's available basically in 4 forms. Book as originally published in USA. The rubric arrangement is very cumbersome. So it didn't catch up with public attention and practice. One other book form available is NER repertory rubrics rearranged in Kentian style done by P. Sivaraman and team. In this version, locating the chapter and rubric is fairly easy than original American version. Third one, NER repertory is included in many softwares, including Radar, HOMEOPATH, Synergy, and many other. Fourth one, if you have a mobile Android and internet connection, This website is wonderful. This is what I had been using since 15 plus years to locate a rubric in NER report. The name of website is HOMEOINT.org. HOMEOINT.org. If you click open this, it's very user friendly. You raise the screen slowly. It has right column and left column. In right column, you see hearing, constant and hearing. Next to that is guiding symptom. I click open this. You can do it in mobile as well as in laptop, Mac or whatever, desktop. On clicking open, it takes you to a page which displays on the top hearing guiding symptom materia medica, 10-volume remedies arranged in alphabetical order. So here this page includes hearings guiding symptom materia medica also. Then if you slowly raise the screen, you find left column and right column. Left column display chapters and sub-chapters as originally present in NER repertory, American edition. Chapter, sub-chapters. On the right side, for quick access, the website designer arranged the chapters and sub-chapters in alphabetical order for quick access. I raise the screen, you read the chapter, sub-chapter in red color, mind, sensorium, inner head, outer head, eye, ear, nose, upper face, lower face, teeth and gums, taste, tongue, inner mouth, throat, appetite, thirst, etc., eating, drinking, hiccup, etc., scrobiculum, stomach, hypochondria, abdomen, stool, rectum, urinary organ, male organ, female organ, pregnancy, parturition, and lactation. Chapter 24. So this is the chapter we are going to see example cases of pregnancy, parturition, lactation. Case is taken in the usual way as taught in college. From that, what is important is sorted out, analyzed, and a suitable rubric is found in this repertory using this chapter. And then cross-verified with that materia medica of hearing guiding symptom of that drug. The symptom relevance is understood better and then remedy is prescribed. So emphasis today is on NER repertory, pregnancy, parturition, lactation. Bother not about potency and dosage. So if you're asking questions, ask questions related to this chapter and this repertory and hearing guiding symptom. Okay. And here you find subchapters, abortion, infant, lactation, lochia, mammary, nipples, parturition, placenta, postpartum, pregnancy, puerperal stage. So these are subchapters, and these subchapters are arranged alphabetically. If you click open subchapter, that will show rubrics and subrubrics again in alphabetical order. I will just show you this example. I clicked open subchapter abortion. It shows rubric abortion, sub-rubric constitution, cough, dry, disposition to, etc., 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 and sub-rubric under that, epoch repeating at same, frequent and early, and all that. So this is the construction of this repertory, this Materia Medica, this website. What are the three major advantages of using this repertory and various chapters? Number one, it contains thousands of single remedy rubrics. Thousands of single remedy rubrics. Number two, we have directly verifiable Materia Medica. If I see one rubric and one remedy, I want to verify that in Materia Medica, I can go to hearing guiding symptom, verify that symptom, verify that rubric, confirm the context, meaning, and relevance, then I will prescribe. Advantage number three, all the symptoms and rubrics are already clinically verified by trustworthy homeopaths across the world. So they are confirmed symptoms, not only proving symptoms, but clinically confirmed also. Now we will go to case samples. KNERR'S obstetrics, and this is the link. If you click, it will take you directly to that chapter, chapter 24, pregnancy, parturition, and lactation. So even though I am presenting the cases quite briefly, please understand in the background, the case was taken in the usual way, and for want of time and presentation brevity, only the essential point is discussed. So this is the woman who came at 7-month pregnancy. Even though she was eating very bland diet, having adequate liquid intake, sleep is good, emotionally happy and peaceful. There is no turbulence in any of these lifestyle, habit, or emotional life sphere. But the complaint is heat sensation, burning sensation, and pain in anus since 10 days. So naturally what I do when patients say some complaint, first thing I try to identify whether there is any exciting or maintaining cause in a diet lifestyle principally. So nothing is available. And I gave enough time for the patient to think back to identify any physical or emotional exciting cause. And she is not able to recall. She says nothing was there. Okay. So the single line symptom available here is heat, burning, pain, anus, and she is pregnant. Okay. So we have 4 components. Pregnancy, anus is hot, there is burning and pain. So what I did is, so you need not take down these as notes or memorize or any specific remedy. If you go to that chapter, locate the subchapter, identify the rubric, identify the sub-rubric, you will find the remedy, and go to Materia Medica section on the top, click that remedy chapter. I will show you how to do that also here. And you will see that remedy, that symptom. So rubric, the chapter is pregnancy. Subchapter pregnancy. Rubric anus. Sensation burning, painfully sore, hot feeling. the remedy was zingiber. So when I see a remedy like this, which is most common dietary article in Indian type homes and Indian food habits, I cross verify with them whether they are taking excess of this article or started recently taking this one. She said, no, sir, I am not taking excess ginger. It is a common spice in our home and it is not in excess and it is not newly added. So I gave her a zingiber. In a day, all these symptoms completely vanished. Okay. So the guideline I follow here, if the patient says, yes, I had been taking ginger recently or taking ginger in extra, if the complaint is mild to moderate, I encourage them to discontinue that irritating substance for 3 days. Generally, the symptoms subside. If patient says no history of new ginger intake, no history of ginger excess, and the complaint is moderate to severe, it is better to give the medicine in potency. So zingiber was given in potency. Patient did well on that remedy. Case number 2. This woman again, another patient, since 1 month, constipation and nausea. So as discussed earlier, I asked for any dietary or lifestyle errors. She said no. And another thing is medications. When they go for a checkup, I take the help of obstetricians in all my homeopathic patients consulting during this pregnancy. The role is to evaluate the health of the mother, the growth of the child. If they suggest any investigation and if it is not harmful so far as reported in medical literature, I encourage the patient to undergo those investigations also. So I take the help of obstetrician, and suppose if the obstetrician suggests vitamin supplements, folic acid supplements, iron supplements, calcium supplements, or any dietary excess, I generally ask them to wait, to follow the advices at home and the traditional practice only. I don't put patients directly on the supplements suggested by obstetricians, even though I take their help to assess and evaluate the health. I don't put them on supplements directly. So in this case, I checked whether patients started taking any such things. Patient said no. Okay, sometimes such supplements may cause constipation and nausea. Patient said no such history. Okay, so patient tried home remedies and tried homeopathic remedies by nearby homeopaths, and there is partial relief and it is still troublesome. So the one line in the case is pregnancy, constipation, nausea. Very plain and direct rubric. So chapter 24, pregnancy, subchapter pregnancy, rubric constipation, and along with that there is nausea. So rubric is under pregnancy, constipation, nausea with cholinsonia. So here there is no specific that you have to remember or you write down this rubric. What you follow is how I am taking the case and what I am giving importance to, and where I search, how I search, and how I come to the remedy. That is important. Then this is the complaint, this is the remedy. So better learn what is the case, how I form the rubric, how I search, and how I come to the remedy. Okay, on giving cholinsonia, patient did well very quickly and she remained well thereafter till the end of pregnancy and delivery. We'll go to next case. Three months pregnancy. All vitals are normal. And check with obstetrician, all parameters within normal limit. Yet, patient was anxious about spontaneous abortion. This is during the COVID lockdown. As pandemic was on and cases are being reported, like either induced or spontaneous. So, however, this patient, I told her and the family, so far, medical world has no precedence as to what will happen to pregnancy, what will happen to the fetus, whether there will be anomalies or normal. And they agreed to proceed with the pregnancy. Okay. So we are more human. At the same time, we go with the tide as well. So she said, I want to continue my pregnancy and I'll try my best to have a normal, healthy child. And I go with homeopathy. Said, okay. Then one thing which I extensively used, if at all, in this period, the word influenza, then COVID, because there is a lot of parallelism between that and influenza. So therefore, I read the literature and I'm convinced that this will be one clinical point I can include in my totality and produce effective result. So initial cases, I was triply careful because I'm trying something new and we are dealing with life of patients. And as the results gave good feedback, then I became more confident and then used it as and when possible. So keywords, abortion, influenza, epidemic. So this I used as a preventive. There is no sign that she will go in for abortion. There will be miscarriage. But patient was anxious. I thought we'll give it a try and follow the patient throughout. Okay. So I'm just telling that this I have used. I don't know whether I can substantiate that only camphor has produced prevention or something else also, or camphor did not act. But I just want to admit that this is the scenario, this is the rubric, this is my understanding, this is the reference, and I gave the remedy, and patient had a smooth pregnancy and normal delivery. So, chapter 24, pregnancy, subchapter, you have to click abortion, and the rubric is influenza during epidemic. The remedy is camphor. On giving camphor, she did really well, and pregnancy was quite smooth. So this is case number 4. She is 42 years. I slightly have a bit confidence with increasing years of homeopathic practice. I bother less about the age of the patient and her pregnancy, primary or even if it is second, third, fourth, because these people respond really well to most suitable indicated homeopathic remedy, and the chance of them needing other supportive measures, other management measures is much, much, much less. In spite of their age, even if they are primaries, they do really well with homeopathic care. Okay. What one very frequent question asked by the pregnant woman, her in-laws and parents, and the entire family is the dietary advice, habit, and lifestyle. Initially, because of having read obstetric books and worked in allopathy hospitals, initially I was thinking that the homeopath also should give very protocol advice to pregnant woman, pregnant mother during lactation, all that protocol, like standard fixed diet, supplements, etc. But I quickly realized that here also homeopathy can play a very significant role. So one thing I tell them is, if you have a good familial background who can support you with familial practices, with the home remedies, nutritious natural diet at home, which is traditionally followed and found effective, helpful, and have no side effect. Wherever this is possible, please adhere to that, whether it is your husband's side or your maternal side. So wherever this is possible, my plain advice is you follow that one. That is rather most suitable than any textbook things. Second advice, I encourage the patient to observe the diet lifestyle that interfere with her comfort. It could be a solid food, it could be a drink, it could be position, it could be movement, it could be light, it could be noise, anything, like exactly the modalities. So if she is observant enough, then I encourage her to avoid them for a short period and see if that helps her. By and large, this solves the problem along with the indicated homeopathic remedy. Okay, so the traditional home practice is by and large is good enough to solve and handle large number of patients. And second thing is encouraging the patient who are sensible enough to observe what interferes with their comfort and wherever possible to avoid it as practically possible. And then with indicated homeopathic remedy. And third most important question commonly I encounter in practice is about vaccination and supplement. I don't say no to them, rather I say that can be used when there is clear-cut indication. So this convinces them largely, and practically there is no need or very rare need for supplementation. Okay, so this is how I answer them and handle. This has helped me and my patients a long way. So coming to this case, age 42 years, due to extraordinary circumstances, I had to medically terminate my pregnancy at second month. Since then, I noticed changes in my breast mammary. I feel some nodules and some lumps. These are there since 5 years and did investigations to rule out malignancy, all are normal. So what happened is she underwent induced abortion that has produced trouble in the breasts. And what are they and how is the rubric? Keyword, abortion, breast lump. So we go to chapter 24, pregnancy parturition, subchapter abortion, rubric sequelae, and sub-rubric is what has happened is breast knots and cakes. The remedy is lac caninum. On giving this lac caninum, breast lump and the breast knots nodules completely disappeared. Okay. So for encouragement and initial enthusiasm, I am presenting cases where I gave one remedy and one rubric which has helped. Okay, this is only to induce enthusiasm in the participant to take up their repertory, learn it, and apply where these things are there. So please also understand there are cases where I use more than one rubric and sometimes I do change remedies in future where first remedy worked partially, second remedy came up, or first remedy didn't work, I use second remedy also. So this is for uh, exciting enthusiasm in you. I am presenting single remedy rubrics, one remedy used, and all that. Okay. Go to case number 5. 2 days since delivery, placenta is not yet expelled, and conventional treatment also did not help. Delivery was normal since 2 days. Severe pain while passing urine. I am terrified to go to urinate. So it is so painful. So what has happened? Placenta is retained and there is problem in the urine. So rubric, the chapter is 24 pregnancy parturition, subchapter placenta, rubric retained, and along with that there is urination with painful. The remedy is cantharis. On giving cantharis, the placenta also quickly got expelled and the urinary complaint became completely normal. So when there is urinary complaint, I don't ask my patients to drink extra water. I don't do that. So what I, not only in this case, any patient for that matter, what I encourage them is to drink according to their thirst and not to ignore when they are thirsty, not to ignore drinking water when they are thirsty. So there also I use individualization and how to identify that that individual is drinking adequate water is the urine color will resemble that of water. So that is the practical clue to monitor that that patient is drinking water adequate for that patient. So there is no protocol like you drink 1 liter, you drink 5 liter, you drink 10 liter. In exceptional cases, only in exceptional cases where there is water restriction required for a certain period. Otherwise, I encourage patient to drink according to their thirst and the urine color should be like that of water. Okay. So then we'll go to case number 6. 26 years, primipara, 12 hours into labor, developed burps, which are too frequent and severe. Home remedies did not help. Injections has no effect. So burps, eructation. So what I'm converting here is during labor, eructations. That is what the patient is having. Okay. So chapter 24, subchapter parturition, rubric labor pains, eructations with. Remedy is borax veneta. On giving borax veneta, eructation stopped quickly and labor was smooth and painless. Okay. So what is required is orientation to repertory, rubrics, contents, chapters, subchapters. We need not memorize. The simple technique is you take this chapter only, chapter 24 only. You need not memorize the rubrics or remedies. 15 minutes a day, 15 minutes a day, subchapter and rubrics and sub-rubrics under that. You just keep reading 15 minutes, 15 minutes, 15 minutes. In 3 months, you will exhaust, practically exhaust, reading all the rubrics and sub-rubrics of this chapter. Then when the case comes, even if patient tells in 30 seconds what is the complaint, your mind will correlate the data, analyze it, and come to the right rubric. And you will have a quick reference and go to the remedy. So there is no job of memorizing here. What is required is this chapter is there. These are the subchapters, and to read how it is constructed, what is the content, how it is constructed. If you orient yourself to that, then the remaining job is quite easy. Okay. So on giving borax veneta, eructation stopped and the labor was quite smooth. Case number 7. Post-delivery, day 1, causing very huge size clots. See, the one riskiest thing is they quickly lose large amount of blood, either as fresh blood or clots, and they'll become quite pale, anemic, have a very severe impact on all her own bodily functions, as well as that will influence the child. So acting at this phase is, especially when it is hemorrhage, the remedy should act very, very, very fast and produce very quick result. So this is one very critical phase. And for academic interest, there is one syndrome called Sheehan's syndrome, Drummond's disease. I think these two are related to postpartum hemorrhage, where the pituitary will go for infarction. Because of this hemorrhage here, the circulating blood to pituitary will be so quickly reduced, they will go for infarction, and the patient will develop pan-pituitary syndrome. So those are very severe complications you will never think of, and it will happen so quickly. So this is one critical condition postpartum, that where there is hemorrhage, our remedy should act quite promptly. Otherwise, stand off and let the doctor do something else and arrest the bleeding. Now, passing huge size clots. I am growing little pale, feel chilly, faint, weak, giddy, short of breath, increased heartbeat. Doctors planning for blood transfusion and injection to stop hemorrhage. And my aunt who visited me said one of her friend had similar situation, but later developed heart attack. And the doctor said who attended heart attack, it could be due to anti-hemorrhage injection she had few years ago. So patient is now in dilemma, fear also. One is she is losing blood and something has to be done immediately. Otherwise, she has to take injection to arrest the bleeding. And there is one potential complication after a few years that it may lead to heart attack. Okay, so at this stage. And then keyword, the state is postpartum hemorrhage and huge clots. So chapter pregnancy, parturition, lactation, subchapter postpartum, rubric hemorrhage, subrubric clot large. The remedy was crocus sativa. And on seeing this, I had a very, because the time is quite short, they have to act promptly and accurately also. I asked her whether you had a saffron intake. She said yes. Okay. So on giving crocus sativa, the bleeding and clot immediately stopped, and patient gradually recovered. There was no need for transfusion or injection, because anyway the lost blood has to be produced by the body. It took bit time there, but I didn't advise any supplement or transfusion. I said do only those things that is not draining your energy. So there also, eat light, small quantity, and exert that will not make you debilitated, that will not make you fatigued. So she gradually recovered, and in a month's time, she's completely all right, and the blood is normal. Okay. Case number 8. It is so strange coincidence, I should say, because these people are my patients since quite long, and even during pregnancy, during parturition, during lactation, they were in constant touch with me, and they are lucky enough to have a homeopathic pharmacy nearby, or somebody can come and collect medicine from me. So that is how I am able to treat these cases even under such circumstances. Somewhere they are not able to reach me, or they are not able to have homeopathic medicines. I could not do anything. But there are a few more memorable cases where the chance was they are in touch with me, they are not able to reach me, and they are able to have homeopathic medicine and give it to the patient, luckily, either with consent of allopathic doctors or bypassing them through some means. So 1 hour post-labor, convulsions, no previous history or any known predisposing factor. The obstetrician is familiar with homeopathy and has fair stock. And here, the doctor herself called up and said, Srinivas, this is what is happening. What is your suggestion? Then the key words are, see, these are things that pumps your adrenaline. So it is a do or die situation. So patient is throwing convulsion, and fetus is dependent on her. So it is a double, triple risk. We have to be accurate and quick. Otherwise, take a decision, say, no, I'm not taking it, and at least allow the allopathic doctor to do what is best in their knowledge and hands. Okay. So the key words are puerperium convulsion. So chapter 24, subchapter puerperal state, rubric convulsion immediately after delivery, amyl nitrosum. So on giving amyl nitrosum, the convulsion stopped immediately. So interestingly, this I remember reading in a book of Dr. S.P. Kopikar. The book is so wonderful, really wonderful. The book is available. Dr. S.P. Kopikar's 70 years clinical experience. I think that is the clinic book title. If the book title is something else, I will post in the group. There, Dr. Kopikar shares one of a beautiful case of his uncle who was there in Mangalore. And one patient delivered almost similar case example. And her mother rushed to Dr. Kopikar's uncle, knowing that he gives homeopathic medicine to poor people, even free of cost. She said, the daughter is throwing convulsion just after delivery. So in excitement, Dr. Kopikar's uncle had an urge to stool. He was rushing to the toilet because of the excitement of this news. Yet he was asking Kopikar to prepare a dose of amyl nitrosum and send. And the remedy made the lady completely all right. So please try to get that book. And if the book title is something else, I'll post it in the group. And you read this amyl nitrosum in Allen's keynote. The exact symptom is there. Amyl nitrosum, Allen's keynote. Case number 9. 2 months postpartum, lactating mother, toothache since 3 days. Did not bite anything hard or cold catching in any form. Teeth not caries teeth. No gingival problems either. Gums are normal. Teeth no caries. And not has bitten anything very hard that will develop toothache. And usually postpartum they will catch cold, get wet by head or feet or body. Then the body temperature changes. They catch cold and sometimes it forms in the cheek and they develop toothache. It is all not there. So keywords here, lactation, toothache. So chapter 24, subchapter lactation, rubric toothache. The remedy is Cinchona, China officinalis. On giving China, toothache is gone. So I don't try any specifics or high grade remedies or anything therapeutic. The simple point is plainly listen to what patient says, very plainly. And many a times there is even no need to ask any question. Very plain expression of the patient, that itself shows the rubric, and the direct rubric is there in NER repertory, and give the remedy, patient will do well. This is case number 10. The month since delivery, the vaginal discharge is going on. From day one, see, this is what I said. Patient tells so important thing so casually, and if you're not extraordinarily alert and sensitive, we will ignore it. We will think it is common, it is of no value, and we'll be breaking our head and don't know what to do. Patient said, the vaginal discharge postpartum is hot. I feel that the discharge is coming out and it feels hot to me in vaginal. First, I thought because of my body heat, it is like that, or could be due to the medicines given in hospital. I tried cooling home remedies, diet, etc. No change. I asked my mother, cousins, in-laws. None had this type of discharge. There is no itching, burning smell, but I feel uneasy and strange. Doctor said there is no test for this also. So no diagnosis either. Okay. So the plain simple factor is She is having lochia, which is hot. That's all. Lochia is hot. So chapter 24, subchapter lochia, rubric is hot. The remedy is belladonna. So on giving belladonna, the heat is gone, lochia is gone. Patient did well. Okay, so thank you very much. We'll stop the sharing here. And we can go for questions, answers, you can read out. Or participants can unmute themselves and ask questions.
Thank you so much, Doctor. Participants, please unmute yourself and ask question to. Please raise your hands. I will allow one by one.
If they type in the chat box, you can read out also, Doctor.
Indranil. Dr. Indranil. Yeah. Please ask.
Yeah. Can you hear me?
Yes, yes.
Yeah. Sir, firstly, the lecture was very nice, very informative, and we are thankful for that. I'm Dr. Bavdekar from Pune, Maharashtra. Sir, many a times it happens that along with the chief complaint, there are 2-3 complaints also of the patient for which they have come to us. And when we repertorize, for every symptom we get a different remedy. Then how to come to a common remedy by using their? Can you guide us for this?
I read Materia Medica. I do two things, sir.
Huh.
If common remedy is not coming, I evaluate which one is most important and more central in that case.
Yeah, okay.
Second thing, I read the Materia Medica because there is a direct single Materia Medica. Compared to all other repertory Materia Medica, this is one direct reference Materia Medica.
Yeah.
I read, differentiate, and give that one remedy.
Okay, but should we stick to the only chief complaint or concomitants also we should consider? But if they don't match, your theory is okay, accepted, means core of the case.
The value weightage, what I give is number one. If there is a concomitant symptom, that is the first one I will look for. My remedy should cover that.
Okay.
Number two, symptom with paradoxical component. Say, for example, breathing difficulty, better by running. Fever, no thirst. Chills, thirst for ice cold water. These are paradox.
Yeah.
So if that is present in pregnant cases also, I will use that one, paradox. That is second importance. Third one, symptom with more components. Then 2 words, if patient has 3 component symptom, 4 component symptom, I will look for it and give the remedy that covers that one.
Okay. Acha. I got it, sir. Thanks for your guidance because that was a confusing point for us. Correct. Thank you, sir. Yeah.
Thank you.
Thank you, Dr. Indranil. And any other participants? No question in the chat box. Absolutely marvelous. Did you try the same with other than pregnancy session?
Yes.
And if a pregnant lady have less fluid, which medicine you use?
Refer her to me.
To take the totality, right? Okay. Any other questions? We have 9 more minutes. If you have questions, you can ask.
It requires more systematic study and training, doctor. I presented things quite simply. In the background, there is years of labor, study. How to
Yeah, exactly.
orient.
Actually, what you said, at least 15 minutes per day spent with this. And what you said is actually we are spending many many hours in behind many things, but particularly we are not spending to a
One thing.
separate area or one area. We are like Aviel. That is the thing. 8 months pregnancy with complete blood rest. Bed rest. Dr. Raman, you can ask directly, because if you're saying the things incompletely means.
He can ask in Malayalam also if he feels easy.
Dr. Raman, I will unmute you.
Doctor, you can ask in Malayalam also. I'll try to follow and translate your question in English for viewers in other parts of the world.
Okay, I'll unmute. Dr. Raman, you please come forward and ask question, because okay.
Hello.
Yes, you can ask.
Hello.
Yes,
Hello.
it's audible. You can ask.
I'm the patient 8 month pregnancy, and every time when ultrasound done, doctor said कि fluid कम है, अभी तक डिलीवरी करना पड़ेगा. तो कोई होम्योपैथिक मेडिसिन है तो उसका फ्लूइड इंटेक बढ़ा दे for safety of child.
Sir, please repeat your question, sir.
8 month pregnancy, the baby age is 32, or every time when ultrasound done, so they said the fluid less. So you take complete bed rest or fluid intake more, but patient can't eat properly, not take liquid intake. Complete bed rest, and doctor said कि early delivery करना पड़ेगा 8 month, क्योंकि fluid कम.
Okay.
तो कोई medicine help कर सकते हो?
Yes, sir. So, I don't prescribe on investigation report or doctor opinion, sir. So what you explained so far is investigation report and doctor opinion and doctor advice. In all the 10 cases I presented, I used the information of what patient said. So it is to take the case, come to clinical totality, and then prescribe the remedy. Not ultrasound, low fluid, bed rest. That rubric will not be available in repertory, sir. Thank you.
So if I have one question, if there is less fluid means what kind of symptoms patient will express?
Question forwarded to obstetrician.
No, what I'm telling, while during the scanning report, while getting the scanning report, we will get such kind of cases, no? So if the fluid is less, also we have to only see their difficulties. That you mean, right?
Every individual patient will present with beautiful characteristic in a most plainest language, very casual. If I am alert and sensitive, I will catch it and prescribe. If my mind is precluded, prejudiced, and with so much of other thoughts, I will not see this.
Okay. And Dr. Leda and Dr. Indranil has again asked, are there pathological rubrics also seen in repertories?
What is the question?
Are there pathological rubrics also seen in the repertories?
Yes, thousands. But if you prescribe on pathological rubric, the result percentage is very poor.
Okay. And how we take key symptoms with 20 or 25 dementos of the patient? Dr. Lata Manoharan is here, no? Please ask, please come forward and ask. Dr. Lata Manoharan. Doctor, please.
Thank you, Ajin Doctor. Thank you, Srinivas Doctor. I ask you, with the 20 or 25 symptoms of the patient, from how we can take the rubrics from that symptoms within 25 or 20 symptoms?
I give importance to, out of the 25, that symptom with concomitants, I will give importance.
Okay.
Second importance is paradoxical symptom. High fever, no thirst. Body is chill, shaking chills, asking for ice cold water. Breathing very difficult, better by running. Like this, no? So
Yeah.
out of those 25 things, I will look for these kind of symptoms and give importance to that and prescribe.
Okay. Okay. Thank you, Doctor.
Thank you.
Okay.
Thank you, everyone. I think now it is to move to the Malayalam session. Actually, Dr. Srinivas has given a big lesson. I mean, we need to work hard behind this, as he's told. It is while we are thinking of it, how we can select 2 rubrics from this much symptoms. I think while working on it, it will come naturally. Otherwise, now our condition is like Alice in Wonderland, because we don't we cannot find any specific rubric from this, because the experience gives you more more key points. Anyway, thank you so much. Actually, we need more discussion on this the selection of rubrics and this especially in the obstetrics cases. We are not even touching that area. Thank you so much, sir, for presenting. But your class gives us more confidence to even to hear the symptoms. if we are not treating also, even to take the responsibility. That thank you so much.
Thank you.
And now it is the time for Malayalam session. I am inviting Malayalam moderator for to conduct Malayalam session. Thank you so much, all the participants. Srinivas sir, come again and teach us. Thank you so much. Bye bye. Good night.
Thank you.
And who is the Malayalam moderator of today? I do. Dr. Shaila. Oh, Dr. Shaila, please. I will make you as a co-host. Dr. Shaila, please.